of particular contraceptive methods, there's been a lot of talk recently about the Depo shot, Depo-Provera, and the new studies that have come out, and we can include those citations, about how Depo has been found to be associated with meningiomas. And meningiomas are a benign brain tumor, not even brain really, it's usually typically the base of the skull. And that sounds really scary. That sounds really scary to a lot of people. And I think it's important that we proactively try to get ahead of these misconceptions related to this, because the studies are certainly valid, but there are some details that I think can really be missed and overgeneralized in terms of what we're seeing out there. A colleague of mine recently did a journal club on these articles, and during his presentation, he showed a screenshot of a search engine, which take your choice of whichever search engine you prefer, and he typed in Depo shot and meningioma. And what, like the first, I don't know, like 5 links that came up were actually law firms, like touting how they're ready to go in terms of litigation related to this. And also as part of that journal club, he brought up some really important points, which really specify that the risk that they saw between Depo shots and the meningioma was related to prolonged use, or over 4 years typically, or initiation like past the age of 31. And while that applies to maybe a good chunk of people, and the results were statistically significant, but clinically really still pretty low risk, that nuance was missed from the search engine. What yielded from that. And so if you have someone come into your office and is like, I've been on the Depo shot, I need to get off of this right now. I really loved it. It really worked for me, but now I'm terrified I'm going to get a brain tumor. How would you approach that?
Yeah, and I would, first say like that, you're absolutely right. Let's talk a little bit about what that study showed, right? And so what that study showed is that there was it is a big study, observational study, where they followed people, and they saw that there is a 5 in 10,000, so 5 people per 10,000 risk of developing a meningioma with the Depo shot. And then in France, their baseline risk was 1 in 10,000. And so the study shows that more than 2,000 patients have to use Depo for one new case of meningioma. So yes, it's statistically significant, but is it clinically significant? That is the question, right? And so I will literally tell people some of these numbers, right? And again, it is very specific to say, like, don't say percentages, because percentages really like have a difficult meaning, but a 1 person in 10,000 is a much easier number to understand, right? And so that's what I would say. I would say, like, look, it is an interesting article, and it means that we have to keep looking into it, but does it mean you have to stop your Depo? We don't know, right? There are a number of different things, but if we also have to look at the other side, if this particular person in front of us, that is the only one they like, and the alternative is risking pregnancy, and many people, pregnancy is way riskier than the actual medication, we have to weigh those risks and benefits. By we meaning the patient has to weigh them, right? So they have to risk getting pregnant.